Healthy People 2010 and 20 are initiatives that are facilitating broad positive health changes for the population every 10 years. The major goals are two big ones: helping people in the U.S. improve the length and quality of their life. Nothing's more important. If this class were something that will help you to achieve an extra year of living or an incredibly good death, by that I think we all know someone who's died a death that we wouldn't wish upon anybody, that had a lot to do with lifestyle-related factors. If that could not be you and you could actually have an incredible life and an incredible death, I think that would be a great thing. Eliminating significant disparities between various segments of the population is also important. We have differences in healthy levels based on race, ethnicity, sexual orientation, all of these things. And we need to eliminate those health disparities with education of all people. How healthy are college students? Many times younger than the general population, but that doesn't necessarily speak to our campus. We have an incredibly diverse campus, which is an awesome thing. If you're surrounded by a bunch of people that look and think and act exactly like you do, it doesn't create for very interesting discussion. We have students of all ages, we have students of all disciplines, all majors, all cultures, all diversity, and that's an incredible type thing. Behaviors that increase the risks of developing these types of diseases, like chronic illnesses, are common amongst college students of all ages. And one of the things is carrying extra weight, physical activity, and so on, as well as alcohol, tobacco, and other drugs, which are all lifestyle things that impact our life expectancy and our health. Common health problems that we report as college students: allergies being number one, sinus, back pain. These will all continue to increase as you get older, depending on your age, but they're all types of different ailments. But they're all signs and symptoms of something that could be an underlying issue. What are some of the factors that affect your health? The things that we look at is that we all have the same basic health needs. And the individual factors greatly affect our health. Our lifestyle choices are within our ability to control. Some factors are beyond our power to control, like our genetics. But many times we look at our family and we think to ourselves that because they have heart disease and other issues, that we must have those things in our future at an early age too. Sometimes that can be genetically predisposed, but it could also be not just that. It could be the culture of what your family eats, how active they are, if they smoke, drink, and so on. And maybe you're not destined for that same life and that same death if you don't partake in the excess of all of these types of things. Making these behavior changes and looking at these different behaviors as a part of regular lifestyle can decrease the risk of developing serious illness in your life. Other factors that influence your health. Of course, age influences your health. Chronic illnesses are more of a concern for older adults. That's a super important thing to think about. The reason they're more concerned for older adults is not because all of a sudden when they hit a certain age, they're attacked by disease. It's because they accumulate the effects of what we do at all ages. Whether we're 8, 10, 12, 15, 30, 70, we start to accumulate these as we go on. We accumulate sun damage. We accumulate cholesterol. We accumulate stress. We start to accumulate all of these psychological disorders, poor nutrition, a lack of physical activity, extra weight. And so all of those things lead to disease, and in many cases they take years. The other thing that's a difference in factors of health is our sex. The biological and physiological differentiators between males and females are a powerful role in changing our difference in chronic conditions. Also, there's new health disparities among different racial and ethnic populations that we'll try and touch on, based on socioeconomic, cultural, nutrition, biological factors, and genetics as well. Where you live also increases your vulnerability to certain health risks. What you're exposed to for health care, your contaminants in the area, and difference in lifestyle, your income and health insurance. Seems pretty obvious. If you don't have health insurance, you're not as likely to go be checked for something that could be life-threatening until it maybe is life-threatening. So those things are, access to that affects our overall health. The last one, where it says health literacy, is the ability to evaluate and understand health information and make really good decisions about what you learn. In this course, we'll try and attempt to get you to be able to understand not only the health information presented, but take everything that you find and attach it to yourself. Addressing the health disparities, important to improve everyone's access to insurance, to health services, being aware of important needs, boosting medical training aimed at patients of diverse backgrounds. These are all aims of the healthy disparities portion of the health issues for 2020. Achieving successful behavior change. So now you're thinking, okay, I have these things about myself that I'd love to be more healthy. How can I do that? How can I be successful? I have people keeping me down. To make the right choices to benefit health can be such a tough challenge, and achieving that true behavior change is super difficult. What are some of the things that affect that? You're thinking, I want to make change, but my spouse doesn't, or I can't have because my kids are in the house, or I want to be able to do this, but I'm not strong enough, I don't have willpower. There are predisposing factors that can shape your behavior, and these are your physical, mental, and emotional things. There's enabling factors. What are the skills and capacities you have to shape that behavior? And the reinforcing factors, encouragement or reward. And a lot of times we encourage or reward with the opposite of what might be positive. For example, we're on a diet, and so we reward ourselves with a beer or a piece of cake on a Friday night. Or encouragement or reward when it comes to physical activity. We reward ourselves with a day off. We have to change the way that we think about doing those types of behaviors. And we also have to make sure that we've got other people on board. We can't possibly make change if your spouse or your partner or your best friend or your kids aren't all willing to make that change. And think about, if you're a role model for someone, what kind of role model are you? There's something that you think about yourself, and then there's something that other people think about you. And that, a lot of times, is a really good positive perspective on how you can make change and how those people can help you.